Our President Trump returned to the Oval Office today for the first time since he was diagnosed with and treated in the hospital for COVID-19. Trump had been in isolation in the residence, but went to the Oval Office to be briefed on Hurricane Delta and stimulus talks. You can see the Marine posted up right there outside the door of the Oval. The White House said they have additional safeguards for any staff who interacts with the president, who is likely still contagious with the virus. There are still a lot of questions about how President Trump was treated for COVID-19. 10 Tampa Bay reporter Leah Fernandez sat down with experts at Sarasota Memorial Hospital to find out more about the drugs that POTUS received.
It's more at looking at what we do and how the virus responds.
Doctors have been working overtime to find a COVID treatment that is foolproof.
So you've got the remdesivir, which is an antiviral medicine, sort of like a Tamiflu. And then you've got one way or another to attack it using antibodies, either in the convalescent plasma or in this Regeneron polyclonal antibody cocktail.
This cocktail is currently under clinical trials at Sarasota Memorial Hospital and one of the treatments President Trump received at Walter Reed Medical Center. If a patient's oxygen levels worsen,
then we will initiate steroids, dexamethasone, which is another medicine that the president received.
If an average person walks into the hospital with COVID, can they get the same treatment that the president received?
Absolutely. Starting out with the remdesivir, the monoclonal or the polyclonal antibody cocktail, of course, the cheap dexamethasone.
But the process isn't as quick.
If you want to have access to Regeneron, obviously you have to call the research center, and we screen you and we see if you qualify for one of the studies.
President Trump, on the other hand, did not get it through a study. He got it as an exception with approval from the FDA. Doctors felt the benefit outweighed the risk.
I think that just enforces that, one, the virus is still out there. Just because the president has COVID doesn't mean that everybody should panic. It's still at a low level here in Florida, but we should not let our guards down.
It's the message we've been consistently hearing. Now, Sarasota Memorial says they have a stockpile of convalescent plasma and a fair supply of remdesivir left over. Price-wise, some of these treatments aren't cheap. Others are. Some are costly.